Hi, good morning, good afternoon, or good evening, wherever you are. My name is Rachel Ong. I've been invited as the co-moderator for this wonderful World AIDS Day Conference 2021. We'll leave the details till much later, but before we begin, a couple of housekeeping rules. We do note that this is a webinar, so you would not necessarily be able to see everybody in this room. Please note that we don't adone disruptive behavior. So please don't be surprised if you're being very nasty, that you get bumped off the webinar completely and suddenly. This is a warning to all of you. I am based in Singapore. I'm the regional coordinator for Global Fund Advocates Network Asia Pacific, and we are very, very proud to be one of the co-organizers for this conference. So please note that this is the plenary session. We'll have 3 other sessions after this, and this will run between 10 to 4 p.m. Central European Time. Session 1 will be on the situation in Asia Pacific. Session 2 will be about changing the global health architecture, and Session 3 will focus around global health financing. So please note that you do not use the chat function for asking any questions or providing comments. We'd like to be able to capture all the questions succinctly and easily, so please use the Q&A function at the bottom of the screen to ask the questions or provide comments. Do note that interpretation is being offered, so please go to the interpretation button and choose the language of your choice. After every session, we will have a short break. You can stay online so that you can stay in the sessions in between and run to the washroom if you want, or you can enter with the same link again. So now I give the floor over to Christine.
Thank you, Rachel. Good morning, good afternoon, good evening. I'm Christine Stegling. I am the Executive Director of Frontline AIDS, a global civil society partnership working jointly on AIDS all over the world. I'm really happy to co-moderate this morning with my fabulous co-moderator, Rachel. And we're very happy to have all of you here. So this is the opening plenary. As Rachel said, we're looking at Global Health Champion Germany with a question mark, and looking at from HIV to COVID, and looking at whether or not we learned from HIV to COVID, what have we not learned in that journey. I want to start by giving the mic, the virtual mic, to Sylvia Orban, who will give some short opening remarks on behalf of the organizers. Sylvia is a board member of the German AIDS Federation and Action Against AIDS Germany. So over to you, Sylvia.
Thank you, Christine. Sehr geehrte Damen und Herren, liebe Konferenz.
So, ladies and gentlemen, dear participants, I would like to wish you a very warm welcome here today to our international conference, Global Health Champion Germany, ! From HIV to SARS-CoV-2, what have we learned or what haven't we learned yet? So we've organized this conference in cooperation with AIDS Action Europe, the Deutsche AIDS-Hilfe, AFAN, and GNP Plus network. So we're very happy to be here today and to be able to welcome you. So since 2 years, the world looks at the COVID-19 pandemic because we're just in the midst of the pandemic. We have different infectious diseases such as tuberculosis, HIV, malaria. They have been put into shadow. They have been overshadowed by the COVID-19 pandemic. And this is why we would like to discuss today with different experts coming from different fields, with different community representatives, with people being touched, being affected by tuberculosis, malaria, and HIV/AIDS. And of course, we would also like to discuss today with different employees and representatives of the Federal Ministry for Development Cooperation and Economic Cooperation. We will deal with the question, what are the needs? What do we need? What can we do? What's the impact on TB, malaria, HIV and AIDS? And what can we do in order to overcome, to tackle this problem? And what about the new federal government in Germany? What can they do? What will they do? And I think this is just a very timely conference, arriving at a very timely point in time, because next year the replenishment conference will take place, and there will be different meetings organized by Germany, and there will be a new federal government. And of course, we will see whether Germany can fulfill its prestige and can respond to it and really fulfill these shoes of a global health champion. So after many members of the civil society and representatives of the parliaments and the governments will take part in the replenishment conference, communities from the south and from eastern part of the world will take part in this conference today. So the first part has been organized by our colleagues of the Asia Pacific Network. And thank you so much. You are a great example. Thank you so much. It is a great example for a great cooperation and collaboration. So thank you so much. And we made something up, something special. We have a special idea. We, for every session, there will be a rapporteur given reporting and given the point of view and the opinion coming from the center of the communities, from Kenya, for example, and also from other countries. And you will report on how people deal with the impact of COVID-19 and the TB, HIV, malaria, etc. And Alexei made different videos for us, and they will be published in the upcoming weeks. And I'm very much looking forward to this conference, and I hope we will have great discussions. And I would like wholeheartedly, from the bottom of my heart, thank you for your support and your organization. And now I would like to hand back to Rachel Long and Christine Stegling. Thank you so much for being the moderators. Thank you so much for your work. Very much appreciated. Thank you so much, Sylvia.
Thank you for setting the scene for a good day, but obviously to start with, for good morning. So before I go anywhere else, let me just introduce Daniel Townsend, who is the focal point for the Global Fund NGO delegation Germany, and who is the rapporteur. Daniel, could you switch on your microphone, your camera for a second? Not enough coffee yet for me. If he's not there, I hope all good. Anyway, Daniel is rapporteuring the session and really writing from a community perspective, which will be published with the recording of the plenary. So we're glad to have him here, even though I don't seem to be able to identify him right now. Oh, you're having issues with your camera. Okay, good, but you're here. That's the most important thing. Wonderful. Right. So we have an exciting program this morning. I'm just going to say a couple of things, but we will introduce people as we go along. Just to note that we have two video contributions to start with, from Winnie Byanyaima, the Executive Director of UNAIDS, and from Peter Sands, from the Executive Director of the Global Fund to fight HIV, TB, and malaria. But then we'll have a panel discussion and we will introduce people as we get there. But we will start with the two videos, and we will first start with a video from Winnie Byanyaima, who, as I said, is the Executive Director of UNAIDS and who has prepared a short statement to the title, because it is World AIDS Day and it's difficult to have to be in too many places at the same time. So I hand over to Melanie to share the video with us now.
Dear friends and colleagues, thank you for inviting me to deliver these brief remarks during the opening of your timely conference. The German government, civil society, and communities have been crucial partners in the AIDS response for many years, contributing resources and expertise in the spirit of solidarity to ensure no one is left behind. During the colliding pandemics of HIV and COVID, Germany further stepped up its commitment and leadership on global health and HIV, for which we are extremely grateful. We need you more than ever now. So on this World AIDS Day, and my solidarity with all around the world as we confront the impact of colliding pandemics. This year, the world agreed a bold plan that if leaders fulfill it, will end AIDS by 2030. That's so exciting. But today, we, as the Joint United Nations Programme on AIDS, we issue a stark warning. AIDS remains a pandemic. The red light is flashing, and only by moving fast to end the inequalities which drive the pandemic can we overcome it. Where leaders are acting boldly and together, bringing together cutting-edge science, delivering services that meet all people's needs, protecting human rights, and sustaining adequate financing, AIDS deaths and new infections are becoming rare. This is only the case in some places and for some people. And without the inequality fighting approach that we need to end AIDS, the world will also struggle to end the COVID-19 pandemic and will remain unprepared for the pandemics of the future. That would be profoundly dangerous for all of us. Progress on AIDS, which was already off track before COVID, is now under even greater strain as the COVID crisis continues to rage, disrupting HIV prevention and treatment services, disrupting schooling, disrupting violence prevention programs, and much more. On our current trajectory, we are not bending the curve fast enough, and we risk an AIDS pandemic lasting decades. We have to move faster on a set of concrete actions agreed by member states to address the inequalities that drive HIV. Through fighting the AIDS pandemic, we have learned a lot about what we need to do more of to end AIDS and what we need to do for all pandemics as well. We urgently need sufficient community-led and community-based infrastructure as part of a strong public health system that's underpinned by robust civil society accountability. This is a prerequisite. We need policies to ensure fair and affordable access to science. Every new technology should reach each and everyone who needs it without delay. We need to protect our health workers and to expand their numbers to meet our urgent health needs. We must protect human rights and build trust in health systems and all public systems. It is these that will ensure that we close the inequality gaps and end AIDS. But they are too often applied unevenly, they are underfunded, and they are underappreciated. On this World AIDS Day, I salute the frontline communities who have pioneered the approaches shown to be most effective, who have driven the momentum for change, and who are pushing our leaders to be bold. I urge you, activists, communities, keep pushing. And world leaders, let us work together urgently to tackle these challenges head on. I urge you, be courageous in matching your words with deeds. There is not a choice to be made between ending the AIDS pandemic that is raging today and preparing for the pandemics of tomorrow. The only successful approach will achieve both. As of now, we are not on track at all to achieve either. If we take on the inequalities which hold back progress, we can deliver on the promise to end AIDS by 2030. It's in our hands. Every minute that passes, we are losing a precious life to AIDS. We cannot afford that. We don't have time. Let's tackle inequalities. Let's end AIDS. Let's prevent all future pandemics.
Thank you so much, Winnie, and that was very, very powerful. We do not have to choose whose lives we have to save is the really, really important message and the theme of the World AIDS Day this year. So next, without further ado, let me introduce Peter. Peter, as all of you know, is the Executive Director of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. And before that, he had a very long and distinguished career with Standard Chartered Bank. So, Melanie, over to you.
This year marks 40 years since the first cases of AIDS were reported. In that time, more than 77 million people have become infected with HIV, and over 34 million have died from AIDS-related illnesses. 20 years ago, HIV seemed unbeatable. But over the course of 2 decades, thanks to unprecedented global activism and solidarity by many partners, extraordinary progress has been achieved. One of the game-changing moments on that trajectory was the creation of the Global Fund, born out of this global movement and rooted in the G7. In those 20 years, AIDS-related deaths have dropped by 65% in countries where the Global Fund invests. Together, we have proven that a united world led by strong communities, with leadership of implementing partners, generosity of donors, the support of technical partners, can drive even the most challenging infectious diseases into retreat. But COVID-19 now threatens to derail decades of progress for HIV, but also for other diseases such as tuberculosis and malaria. The pandemic has put an additional burden on already overstretched health systems, and the socio-economic impact has been devastating for the poorest and most marginalized. For the first time in the Global Fund's history, key programmatic results for HIV have declined. In 2020, the number of people reached with prevention services declined by 11%. More babies were at risk of becoming infected with HIV at birth because their mothers were unable to access preventive treatment. COVID-19 has exposed the most vulnerable to even greater risks as lockdowns and restrictions to curb the new pandemic cut access to life-saving HIV treatments, tests, care, and prevention services. But these unprecedented times have also seen extraordinary resilience. Supported by the Global Fund, communities responded with imagination and determination to support people on antiretroviral therapy to sustain access and continuity of treatment, despite the disruption from the new virus and from lockdowns. In fact, in 2020, the number of people accessing antiretroviral treatment actually increased by 9%. The Global Fund has also supported important health innovations like co-testing for infectious diseases, COVID-19 and HIV simultaneously, multi-month dispensing of antiretrovirals, self-testing, and digital tools for prevention and treatment support. Together with partners, the Global Fund joined forces to create the Access to COVID Tools Accelerator, ACT-A, a mechanism to enhance collaboration and coordinate the global response to COVID-19. Having deployed over $4 billion in addition to our funding for HIV, TB, and malaria programs, over $4 billion to support countries' COVID-19 responses, the Global Fund has been the primary channel for providing grant support to low and middle income countries for COVID-19 tests, treatments, including oxygen, protective equipment, and critical elements of health system strengthening. Essentially, support for everything except vaccines, which are provided through COVAX. Throughout this crisis, countries have leveraged the investments made in health systems to fight HIV, TB, and malaria to better respond to COVID-19. The capabilities to prevent, detect, and respond to diseases like COVID-19 and future pathogens are essentially the same capabilities as needed to fight existing pandemics such as HIV. We are tremendously grateful for the support and confidence of our donors, like Germany, whose generous support has helped ensure that the Global Fund can continue its mission and further support partner countries during this crisis. Without this support and without these interventions, the situation would have been much worse. But the reality is, we still need to do more. We are far from through this crisis. There will be no global recovery from the pandemic while some are still left behind. We have the tools to fight COVID-19. We must ensure that everyone, everywhere, has access to those tools. We have seen again and again that pandemics thrive on and exacerbate inequities. While we have made great progress on HIV in increasing access to treatment, in increasing the effectiveness of prevention activities, structural and social inequities, stigma, discrimination, and criminalization continue to fuel HIV infections and deaths. If we want to beat HIV, and if we want to beat COVID-19, and we want to protect against future pathogens, we must recognize and tackle such inequities. The Global Fund is the largest multilateral investor in grants for health and community systems. In fact, we've increased investment nearly 8-fold in programs to remove human rights and gender-related barriers to accessing health services since 2016. These investments are not only critical to address the earlier pandemics, HIV, TB, and malaria, but also new pandemics like COVID-19. These investments will also ensure more equitable access to health and will be the strength, the foundation of our response to future health emergencies. Germany has demonstrated incredible, consistent leadership in global health and sustained leadership under the new government and via next year's presidency of the G7 will be critical to building a more equitable and healthier world together.
Thank you, Peter, and thank you in particular for the powerful reminder of the central role that communities have played in responding to HIV, but how we can build and must build and have partly built onto that community infrastructure while responding to COVID. So a very good reminder that, and I'm sure that part of that will be part of our conversation later today. It is now my great pleasure to introduce Cindy Kelemi in real life, not on a video. So I hope Cindy is there. Cindy, can you switch on your camera? Cindy Kelemi is the Executive Director of the Botswana Network on Ethics, Law and HIV/AIDS, Bonella, an organization that is very close to my heart. I had something to do with it some time ago. And Bonella is also a very active partner of the Frontline AIDS Partnership. So Cindy is a really established human rights advocate, not only at national level, but also at regional and global level. Cindy will give us a few remarks here as in a similar way as Winnie and Peter, but Cindy will also have some more time to engage when we have the actual moderated discussion with our other panelists later on. So over to you, Cindy, to give us your initial remarks.
Thank you so much, Christine, for the invitation to this platform. And thank you so much to the organizers of the conference for extending the invitation to us. It is indeed an honor and a pleasure to be here to share the community voice, being given that I am from the Botswana Network on Ethics, Law and HIV/AIDS, as Christine has introduced me. And we are a national NGO, and our mandate really is around integrating human rights into the national response to HIV and AIDS. But over the years, as the response evolved, so we did evolve as well as an organization, such that we are now looking at health broadly. And this presents a great opportunity for us to share the work that we are doing as Bonella. So to start off, just to recognize the theme for this year's World AIDS Day, which is basically looking at ending inequalities for us to be able to end AIDS. It has taken us a long time to recognize that it is indeed important for us to address underlying inequalities that exacerbate or make people at risk and vulnerable to HIV infection. But we are grateful that at this point, it is the focus of our work, and we realize that it is indeed important for us to address inequalities in order for us to achieve epidemic control or the end of AIDS by 2030. Our submission as an organization is that for us to get there, for us to be able to remove inequalities, it is important for our response to be human rights based, or human rights should be at the center of the response. We believe that that will ensure that essential services do reach people, especially those who are vulnerable and marginalized. It is also critical for us to address underlying issues related to discrimination and issues surrounding equality. So if we are to respond from a rights-based approach, we have to ensure that we do not only talk to these principles, but we also live these principles in terms of our approach to programming and our approach to policy and policy review, as well as law enactment. The other element that is critical to a human rights-based approach is addressing issues related to vulnerability and marginalization, particularly of those who are mostly affected or infected. So HIV is a good example of how, when you put at the center those who are directly affected and also providing opportunity for them to lead response, we are able to get all our communities rallying behind our response, but most importantly, them informing the response in terms of what the needs are and what are the areas that we need to focus on. Another important element of a rights-based approach is obviously accountability. I'm happy that the previous speakers have already shared the critical role that is played by non-governmental organizations or by civil society. And this is to hold duty bearers accountable, to speak truth to power. This is really important because without this voice, policymakers, political leadership may not necessarily have the interest of people at heart. Therefore, this voice constantly reminds the political leadership, reminds the policy leaders that they need to put people at the center of the response. More often than not, we have seen that countries have made decisions on the basis of economies or on the basis of other issues, as opposed to what the needs of the communities are. And lastly, it is important that we ensure a holistic approach to service provision. I think HIV has taught us that we cannot use piecemeal approaches because one right depends on another. For instance, it's important that when we provide services, we ensure that it's holistic, because we have one client who may be HIV positive, but they also have non-communicable diseases. They may suffer from mental health related issues. So how do we ensure that we provide this one person with a holistic service package that is able to address their needs? And talking about inequalities, we also know that we have epidemics within epidemics. For instance, we are dealing with the issue of gender-based violence, especially within the context of COVID-19, where we have seen, particularly here in Botswana, the rising cases of gender-based violence. Of course, there were questions about, could it be that these issues have been happening without them being reported, or it's a question of us being closed in one area and unable to escape, especially within the home front. So these are some of the issues that we need to be addressing going forward. We also have issues around harmful gender norms. And these continue to put women particularly at risk of HIV infection. Here in Botswana, we have a problem that is emerging. And I want to believe that it's not necessarily that it's new, it's only that as communities, we have started documenting issues around harmful gender norms. And one of those issues is child marriages. We have seen in many parts of Botswana where children as young as 9 years old are married off to 52-year-olds in some instances. And these are some of the examples of how it will be difficult for us to reach epidemic control if we still have children being exposed to such relationships where they've got no power or the means to take any decision about their bodies. We also have to address issues around stigma and discrimination. Many people have argued that a lot of some of the deaths that we have experienced in the HIV response are a result of stigma and discrimination, or were caused by stigma and discrimination, because it prevents people from accessing services. It also prevents people from, going to health facilities and being able to receive the care that they need. We also have to integrate sexual and reproductive health rights into the work that we are doing. The concept of bodily autonomy and integrity, for instance, you can see that in most African countries, including our own Botswana, it is a concept that is very difficult to implement within a context of patriarchy. So how do we address all those underlying issues such that women, particularly and young girls, can have the opportunity to access sexual and reproductive health services, including family planning? We also have to address issues around human rights literacy, as well as addressing the law and policy related issues. I am happy that as a country, as Botswana, we have demonstrated through a court ruling of yesterday that indeed communities have the capacity to change laws and change the landscape by using the courts, for example, to ensure that we decriminalize homosexual acts in Botswana. So these are some of the examples that show that when we put communities at the center of our response, we are able to get long-lasting and sustainable results. And the judgment from yesterday is a key example of that. I don't know if I should continue. Christine, am I okay on time?
Well, if you come to an end in the next minute or so, then you can say some of the other things you want to say in the discussion. That would be lovely.
Okay, so one of the areas that I also want to highlight, which is critical as a lesson for us going forward, is the issue of solidarity. In the HIV response, we saw the world coming together, working towards a common goal of eliminating HIV. But that is contrary to what we are seeing with regards to COVID-19. We would expect to see a much more united global community that is approaching the COVID-19 with a common purpose and move away from the nationalistic approaches that we are seeing currently. So this is something that as communities would want to see happen, and we know that it worked with HIV and it worked with other epidemics as well. So there is potential for it to also work with COVID-19, considering even the transmission modes of COVID-19. And then the other component as well is the multisectoral nature of the HIV response. I think we can all agree that there was quite a lot of mobilization and ensuring that people or different sectors come together to ensure that we address HIV as a collective. And that has borne a lot of fruits, especially at community level, where there is community ownership, and there are also community-centered approaches to addressing HIV, something that we are not seeing with COVID-19. We would want to see a COVID-19 response that is more integrated and acknowledges the critical role that can be played by communities, including civil society. So these are some of the things that we would want to see going forward, especially from a global perspective as well. And then, of course, the issue of community-centered approaches, I think I've already made mention of that. To say that as Bonella, we are implementing a community-led monitoring program that has helped us to document barriers to access to services. And some of these barriers had not been documented before. For instance, we found out that most communities, especially in rural areas, could not even access services, HIV services, because they did not have something as simple as an ID or a birth certificate. So our role was to facilitate for such people to be able to access birth certificate and national IDs. But we also were able to identify some of the policy and legal bottlenecks in terms of facilitating for everyone to have an ID. And our role has been to influence and engage with the relevant authorities so that such people can have IDs. As I speak to you, we have registered or enabled over 200 people who were eligible for treatment to have IDs. So here I'm trying to emphasize the important role that communities play, and also in terms of identifying the needs of communities, which may not be done so by the central government. I will stop that far, Christine, and be happy to answer any questions that may follow.
Thank you so much, Cindy. I'm not even going to try to summarize because there's so many points that's really stuck with me. But what's come very clear is that COVID-19 is but one pandemic that we are facing in our lifetimes. Before this, we faced so many. And even just within this last, 3 or 4 decades, there have been so many diseases that we have been dealing with as, a global community. So we have to be able to take what we've learned from the epidemics before us and apply the human rights-based, gender transformative, people-centered approaches to the current COVID-19 pandemic as well. And we would need legal environments and enabling legal environments to do so. So let's move to the moderated discussions. I'm going to invite our other panelists, Dianne as well as Matt Kavanagh, to please switch on your videos so that all of us in the attendance can actually see you. Great. I can see that Daniel has managed to get his camera to work as well. So Daniel, give us a quick shout and say hi.
Hello, everyone. My apologies for the issues I experienced earlier. I am Daniel Tones, and I'm the constituency focal point for the developed country delegation to the NGO board. It's nice to meet you, and I look forward to a robust discussion. Thanks.
Thank you so much, Daniel, for helping us take notes for this discussion. So I'm going to introduce Dianne. Dianne is the Deputy Director for the External Relations and Communications Division of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. And she's joined by Matt Kavanagh, who is not a stranger to many of us as well, who is a Special Advisor to the Executive Director on Policy, Advocacy and Knowledge Management at UNAIDS. I need to learn where to take my breath in that very long designation. So we're very pleased to actually have representatives from the institutions for this discussion. And Christine, over to you.
Yes, and if we could have Cindy on the same panel now, that would be great. So panelists together. Welcome, Matt and Dianne, and hello again, Daniel. So we wanted to start with a question to all three panelists to start with. Cindy has already spoken a little bit around global solidarity, that we needed to really respond to HIV, and that we only managed the response that we have had because of global solidarity. Obviously, right now, I think we are all asking ourselves whether we have the same sense of global solidarity when it comes to responding to COVID-19, especially when we're looking at access to COVID vaccines and what some people refer to as vaccine apartheid. And there is some sense, I think, while initially we all felt that there was the sense of solidarity, we're all in it together. Now there is the sense of we're not. And some people are more important than others in this fight against COVID-19. So the question is, are we repeating history? And are we repeating history maybe not in a good way? So not the success of HIV response, but the initial piece where we were fighting for access to ARVs. So I'm asking the question to all three of you, Dianne, Matt, and Cindy. And let me start with Dianne. Dianne, do you think we are repeating history?
Thanks, Christine, and hello, everybody. Wonderful to see so many familiar faces. Are we repeating history? I hope not. We certainly have tried really hard over the last 2 years to implement some of the lessons that we learned from the HIV pandemic. And certainly the Global Fund, by getting involved very early in the response to COVID-19, tried to bring some of the principles that were embedded in the Global Fund's birth to the response to COVID. And as you say, Christine, we started off with a approach of complete equity to any new tools that were developed. That already was revolutionary when you think about all those years of battle in the early years of the HIV response to ensure that therapies that were available in wealthier countries were also available in every country where people needed them. That was the reason we all took to the streets in the first place 20 years ago. So we had the right vision. We said we needed to make sure that all of those tools were accessible by everyone everywhere. We had the right rhetoric. We tried to get people around the table. So the Global Fund also, and many of you will remember the struggle over the last year, tried to get civil society at the table, because we said, this is the way we do things. You need a multi-stakeholder response. That had a mixed success rate, I would say, across the global response. And we tried to make sure that the most vulnerable, those who are most at risk from COVID-19, were put at the front of the queue. Another lesson learned from HIV. So a lot of those sort of rights-based approaches were what we tried to convey. And I do believe that it started to work. There was a lot of feeling around the need for global solidarity. I even believe today that most countries in the world and most leaders in the world do believe that that is the right approach to take. But ultimately, we have national interests that right now are winning out over global solidarity. And I'm sure we'll talk more about it throughout the day today. But I think we, as the global HIV community, need to assert ourselves a little bit and say, we've been here before and we do not accept this. We didn't accept it 20 years ago when you said that we couldn't roll out antiretroviral therapy in Africa. And we don't accept it today that vaccines are not available, that testing is at about 5% of what in low and middle income countries as testing in high income countries, that vaccine rates are pitiful and in the single digits when many countries in the West have vaccinated 60, 70% of their populations. And so I think, again, I want to get back to some of those issues later in the discussion, but I think we shouldn't accept the fact that history will repeat itself. So yes, we are in danger of seeing that. And I think we should all band together and work with all of the many people who really do believe in global solidarity to make sure it doesn't happen again.
Thanks, Dianne. Same question to you, Matt. I kind of know what your answer will be, but a bit of perspective from a UNAIDS point of view. You know, where is global solidarity in this new world?
No, thanks, Christine, and thanks everyone for having me today. And you'll be shocked by my answer, right? But look, one of the things that's going to happen later today, actually, is that UNAIDS, along with the Archwell Foundation and a few others, are actually going to be releasing a video on exactly this topic, narrated by Prince Harry and others, that really does look at these parallels from where have we been before on HIV and where are we right now? And I guess I want to make a few points on this from a UNAIDS perspective. One on COVID and then one on HIV today, right? I think where we are right now is that we are repeating history, and it is really deeply unfortunate. And I agree entirely with Dianne that we don't have to, right? We are in this moment where we have every opportunity to switch course, get onto a course that actually uses and learns from the AIDS response. But unfortunately, we're not there right now, right? And the reminder has to be that, you know, early in the 2000s, between 1996 and 2005, we lost 12 million people in Africa when HIV treatment was available, but it wasn't affordable and accessible. That was entirely avoidable. And today, many of the deaths from COVID are entirely avoidable. Right now, we're in a situation where we've got more boosters in COVID going than we do in high-income countries than we do first doses in low-income countries that have been delivered right now. And so this we should understand as a crisis. And so what do we know from the AIDS response, right? Many of the things that Dianne, you just talked about are exactly right on. The other piece that I would just add is that when it comes to affordable access to medicines, we've also learned a lot there, right? What did we do on HIV that eventually, after those 12 million people died, tragically, avoidably, and culpably by many in the wealthiest countries in the world? We learned that, one, we can overcome the patents, right? And so the thing that happened with the Doha Declaration that allowed countries around the world to exercise their sovereignty to ensure that they could make access affordable, that hasn't happened yet. That same idea of the Doha Declaration that happened around HIV needs to happen on the TRIPS waiver today, to give governments back their power to be the regulators of health, to say we're going to overcome patents. And that was a key part of how we got AIDS drugs affordable. But it wasn't all, right? We also built a whole infrastructure around technology transfer and ensuring that actually we built up the capacity to produce vaccines or HIV drugs at the time, that we could be doing the same on vaccines, right? The Indian generic production, but also in Thailand, also in Brazil, around the world, in South Africa, we saw the production of HIV medicines because of those tech transfer and sharing pieces. And then the third, of course, was the funding and the purchase. And so I would say right now in this moment of COVID, we are missing several of those pieces. We are missing using those exact same mechanisms to make COVID vaccines available, affordable. Why don't we have every factory in the world right now with the capability to be making COVID vaccines, making them? Well, that is a huge crisis. That should be #1 priority as we go forward, right? We know that around the world, there are brilliant folks in Africa, Asia, Latin America who could be producing these vaccines, have the technical know-how. There's been this very strange narrative out there that somehow the global South doesn't have technical know-how to make vaccines. And that is just the wrong, it is factually inaccurate and a very old school way of thinking about global health. Second, where's the billions, right? I mean, we should be in this point in the pandemic when trillions of dollars have been lost to the global economy. We have yet to see the wealthy world step up we've stepped up with millions instead of stepping up with billions and billions. And this is where we just know from AIDS that the solidarity approach that's needed, the billions of dollars that need to be invested, where are they? They haven't come yet. And then third, I would just point out, we are in a situation where we have to not lose the points, and Dianne was talking about a few of these about governance, right? From the history of the Global Fund, we learned that it's not just a good idea, it's not just human rights, it's not just a kind of feel good idea that you bring people in who are affected into the governance of global health mechanisms, but that it's necessary for pandemic fighting. We do not succeed when we don't. And I think our current approach when it comes to COVID-19 bears this out. We should be taking the lessons of the Global Fund and saying they are the floor from which we will build on, right? That of course communities will have a seat at the table, but not a fake seat, a real seat. That of course low and middle income country governments are going to have powerful voices in the governance of global health mechanisms, a la the Global Fund. Of course, we're going to be making decisions. We're going to move fast, but we're also going to move together. And those pieces are not happening in the way that they can. And then my final point is just to say that this is also not just COVID-19, unfortunately, right now. We're on World AIDS Day. We are also in a situation where the newest AIDS technologies, if we think about, for example, long-acting PrEP, that's also not available for most of the world right now and is locked up in the same kind of monopolies and is missing sufficient funding to roll out. And so I think we're in a moment of choice. Do we learn the lessons of HIV? Do we lean into those? Or do we revert to a norm that's hugely problematic for fighting pandemics? Thanks.
Thanks, Matt. Lots of food for thought. And before I ask Cindy the same question, I just want to remind participants, as Rachel said right at the beginning, please put your questions or comments in the question and answer function in here. So we do want to hear from you, and we want to make sure that we have some kind of interactive discussion as much as we can do that in a virtual space. We know we're all frustrated by this now, but we'll have to just make do with it. So Cindy, you already spoke, and I just want to remind our panelists that please keep your answers short so we can have a conversation, because obviously we all have a lot to say on all these things. Cindy, you already spoke around, the need for global solidarity. I think it's quite interesting to think about how does it feel right now sitting in Botswana, having gone into some unfortunate spotlight in the last few days with this new variant. Does it feel sitting in Botswana, in Southern Africa, that there is global solidarity, or do you feel we are actually repeating a bad part of our history?
Thank you, Christine. I think it's sad to some degree to be in a situation where we are in, especially as Botswana. One, government showed us that they have the capability to buy medicines, but they could not buy medicines because of all the global bottlenecks that were associated with procurement of vaccines. So it's really sad. And you sit as a citizen, as an ordinary citizen, you wish your government could do something for you. And government is also saying, I've already paid, and I've even paid more than I should have because I needed to expedite the procurement. And then a year later, you still have people who are not vaccinated. You still have shortage of vaccines in the country. So it's really, really sad, and it's impacting people directly. And then the emergence of new variants, which also continuously puts the country on the margins. You know, the most I think the response was basically to say, let's close off our borders. Let's put Botswana on the red light, without necessarily taking into consideration the global responsibility around the response to COVID-19 and how countries can be assisted to deal with such issues, especially emerging variants in respect, of course, to access to vaccines. So affordability is a real issue that needs to be addressed, and we did address it in the context of HIV. It is possible to do the same for COVID-19. The other issue that I also want to highlight is the issue of health system strengthening. I think it has shown us, particularly for us in Africa, that you know, with the continuous dilapidating health systems or crumbling and crashing health systems that we have, it will be very, very difficult for us to respond to any epidemic for that matter. If developed countries were struggling, what more of us where we are starting from ground zero? So as we do our work and focus on global solidarity, it's important for us to look at this issue of health system strengthening as a sustainability issue. There were also issues of sharing the science. I think I want to agree with my colleague Matthew that there is capability in Africa and elsewhere to develop these vaccines. Why not share the science within the already existing frameworks, for instance, around treat flexibilities and others? Why not take opportunity of that if indeed we want to live the principles of global solidarity? And then, of course, while we talk about global solidarity, I also want to say that our governments particularly have a greater responsibility because these epidemics are happening at a time where we cannot even fund our own health responses. So we need to demand more from our governments to be able to invest in health holistically, something that is really, really missing right now. When we look at the Abuja Declaration and the number of countries that have been able to achieve that, very few. And it's also really said that countries like Botswana, who had initially achieved the 15% investment, they've declined. So with the impact of COVID-19 on the budgets, I think it's more critical now for us, especially civil society, to hold governments to account to really invest in health. The other last element that I want to add to it is the issues around governance, issues around corruption. In the midst of a pandemic, in an emergency where people are dying, we still have leaders who have the audacity to employ corrupt practices and benefit from such a dire situation. For me, as civil society, these are the issues that we have to condemn in the strongest terms, but most importantly, have systems in place that can hold government to account, particularly aligning with the people and ensuring that the people's voices are also heard in the midst of such sad situations.
Thanks so much, Cindy. Very strong, very powerful. And again, listening to you makes me and so many of us so angry because we're reliving basically a lot of the same scenarios that we have 20, 30 years ago. I'm just going to say 20 because I want to be a bit younger. But anyhow, I have the same question actually to Dianne and also to Matt. This concerns the new strategies that your organizations have adopted just recently. I think, Dianne, you spoke a little bit about global health solidarity in your intervention just now and what is needed. But perhaps can you be more specific? What is needed from our global health champions, especially countries like Germany, who's part of the G20, part of the G7, sorry, to be able to achieve the 2030 agenda? What is needed from these global health champions to be able to realize the Global Fund's new strategy? And I'll come to you with the same question as well, Matt.
Thanks very much, Rachel. And yes, we do need some leadership, don't we, in the global environment. I think what we've seen from many of the countries and Germany in particular in the G7 and the G20 has been that leadership over the last few years. Germany in particular has been extremely generous in giving large amounts of money, both last year and this year, to the Access to COVID Tools Accelerator. So vaccines, but also one of the few countries that gave to a comprehensive response. So for diagnostics, for therapeutics, particularly oxygen, which was so badly needed in many countries when we had these very devastating Delta waves this year. And also for personal protective equipment to protect those frontline health workers who are so precious in Africa and that it's taken us decades to build up and train. So we needed to move quickly to protect them. So Germany has contributed to the Global Fund's COVID-19 response mechanism, which has already deployed over $4 billion for the COVID response. So to the points raised earlier, there has been an infusion of financing from the G7 and across all of the many elements of the response. But it hasn't been enough. So to Matt's point, yes, we need billions. And it is very reminiscent of those early years of the HIV response as well, when we were talking about the billions needed and we were talking about 40, 50 billion. You all remember the famous 50 billion. And we raised one to start the Global Fund. And so it's been a quite uphill battle to get countries to realize the scale that we need. And what we've been saying over the last 2 years has been that really this is a no-brainer from a financial point of view and for ministries of finance and treasuries across the world, because the COVID-19 crisis, just like the AIDS crisis, costs trillions in lost human lives. Who are people who could be contributing to the point Matt made about the 12 million people that we lost in Africa. Many of those were teachers, they were nurses, they were leaders in their communities. So you're losing a huge amount of sort of human quality when you have crises like this. But you're also losing a lot in basic economy. I'm also talking to you from Southern Africa. I'm in South Africa right now. And the travel ban's impact on the tourism industry in Southern and Eastern Africa is devastating. Those are livelihoods lost, people who can't feed their children because they've been unemployed for 2 years. So the support from the wealthier countries, I'm afraid it is all about the money. And it has to be a huge new investment. The ACT Accelerator is asking for 23.4 billion. And we know that we need that money to mitigate the impact it's having on HIV. Because those of us who've seen this incredible life-saving interventions over the last 20 years, 21.9 million people on antiretroviral therapy, this is a miracle. And we're in danger of losing all of those gains because, as Cindy was saying, the health systems are under so much pressure trying to respond to COVID. So what I would appeal to Germany to do is more money on the table, and then global leadership around a real solidarity approach that does not include travel bans and punishment for countries who actually are doing what the what the world has requested, and making sure that they survey for new variants, that they notify the global community when they see a new variant. These are things that should be rewarded, not punished. And it takes me back, and I think Peter was saying this in the chat, it takes me back to all the work we did on travel bans back in the day with UNAIDS. The Global Fund and UNAIDS led a whole process of getting rid of travel bans for HIV positive people. And to see this be reintroduced is really devastating for me, I have to say.
Thanks so much, Dianne. So Matt, over to you with the same question, succinctly.
So the member states of the United Nations this year adopted a new strategy. All member states, Germany included, adopted this new strategy that really calls for a shift in the AIDS response from a focus on the macro and a focus on the general to a focus on the inequalities. That the gap between the top and the bottom is what's going to make or break whether or not we end AIDS, right? That we've seen this remarkable progress where some in the world have just moved into a space where HIV is not only something you can live with, but something that you can often ignore. And so that reality shows us the reality that could be true for many people around the world, right? Where you are easily living with HIV and thriving, where you are in a context where HIV transmission is incredibly low. That is deeply possible. And so if we then close the gap between those who are experiencing that and those who are living in the world of a continued crisis of HIV, that's how we end it. The bad news is that's harder, not easier. Right? We're not moving into the period of ending AIDS in which we are almost done. We're just on the downward glide and we'll get there if we just kind of close our eyes and hope, right? Unfortunately, the hardest work is actually ahead. So I think three brief things as we try to be succinct. One, funding, right? Just to be clear, Germany has stepped up in this time of COVID and it has mattered a lot. That needs to continue, right? The infusion that came from Germany has been life-saving for many organizations. It needs to continue and it needs to ramp up. For the AIDS response, we need about $29 billion by 2025. Aid as a portion of HIV funding has gone down. And so the reality is that countries themselves are now increasingly funding the AIDS response. And that is good news because countries have stepped up. But that if countries step up and rich countries pull away, then we end up in a crisis. And that's where we're headed if we're not careful. And second, I would say global leadership, right? As we think about this moment of pandemics, if what we do is we divide and we say, over here, we've got the pandemics of the future, and those are the ones that we're concerned about because they might hit rich countries. And over here, we have some sort of other group that is AIDS, TB, and malaria, and we're going to pretend that those are somehow not pandemics. We're going to treat them differently over here. And instead of putting it together and saying, when we're going to respond to pandemics, high-income countries, low-income countries, we are all in this together. The best way to be pandemic prepared is actually to end the crises of pandemics that we have today. And so as we think about things like the Global Fund replenishment, we should be seeing that in a context of ending pandemics, not in a context of kind of old unfinished business that we can maybe get around to at some point, because that's how we end up with resurgent pandemics, as we've seen throughout COVID-19. Thanks.
Thanks. And before I just ask Cindy the last question, we have about 20 minutes or 15 minutes in the end for a conversation with people in the audience. So please do submit your questions or comments in the question and answer function so that me and Rachel can direct them at the panelists. Just a brief kind of, it is World AIDS Day today, Cindy. I think it's important that we say something on that day. What makes us, and maybe what is missing on that day in the world, and what makes you particularly worried, or actually I thought of asking, what makes you angry on that day? I'm thinking that 40 years on, we are on that day commemorating World AIDS Day. Do you have a sense that people are with us and they are talking about HIV and they see HIV as that is an unanswered or a pandemic that continues to cause real havoc in communities and in people's lives? while they're thinking about new pandemics. How does that feel on World AIDS Day, sitting as a community activist in Botswana? How do you feel on World AIDS Day?
Thank you, Christine. It's a difficult question to answer in terms of feelings, because I think over the years, I think when you go through something over and over again, at some point you become numb. And I think that's where I am at, because the challenge really is that we have been with HIV and AIDS now for 40 years, and still we struggle with maintaining momentum and ensuring that we achieve the last lap that we have always said that we are almost there. And when we look at the things that we need to change or shift in order for us to achieve that, these are possible asks. They are doable, but there is some level of reluctance, especially from a political leadership point of view, to really help us, achieve the last lap that we are going towards. When you look, for instance, at issues around removing legal and policy barriers, these are issues that can be done. It just takes political will to do so. Through support from the Global Fund, we were able to do a legal environment assessment, which basically detailed every single law that needs to change within Botswana for us to reach epidemic control. But as I talk to you now, 2 years later, not one of the recommendations have been implemented. So it begs the question, where is the commitment to really end this disease? For me, that is where the frustration is coming from. Now we are at a time where COVID-19 has come in, and it's reversing the gains that we have made. I was in one part of Botswana in Maung, and we were having the same discussion. And the district AIDS coordinator there was indicating that they are losing people from the system, losing them. They don't know whether they passed on or they don't know whether they moved to other areas. But basically, you sense some level of chaos in terms of the AIDS response and the lack of leadership. And you can also see that the attention has now shifted away from HIV to COVID-19. So we are saying that let's look at all these epidemics, HIV, malaria, TB, COVID-19. Let's look at them with the view to address all of them in equal proportions and not forget about the others. Hence, we find ourselves in a situation where we cannot even manage. So I don't know if I'm answering you, Christine.
You are. And before Rachel comes in to go to the audience, I just want to make one personal comment. You know, one of the things when I hear you speak, many of the people here in the call might know that I was the executive director of Bonella. We did a legislative review in 2005 or 6, I think. So, you know, so we have been saying as the community, what's wrong with the laws, what's wrong with human rights, what's wrong, what are the structural barriers? We've been saying these things for 20 years, and we said them at a time when there was great political leadership. And as you point out, Cindy, now we are saying them when in many countries we don't see political leadership that is supporting our response to AIDS, and that makes it double frustrating, right? So 20 years of working on similar issues, which are the structural barriers that are uncomfortable, complex, they're not as easy as talking about biomedical interventions. And at the same time, we're now saying in an environment where we lack political leadership. And that's why I think the session today and this conference today around, what do global champions look like? It's also translated at local level, right? At national level. What do our political leaders and leadership at a national level look like? So a really good reminder. Thank you. And I'm slightly abusing my moderator privilege here, but I did need to say that. Rachel, do you want to pick up on the question in the question and answer?
Sure, I'm going to abuse my, privilege as well in a certain sense. I think one of the things that we have taken so long to actually put on the table is the phrase putting the last mile first and leaving no one behind. But we're repeating the scenario again with this pandemic. What are we doing wrong? And maybe the we isn't us as a community, but what are they? What are you doing wrong as governments, as decision makers? Why are you repeating the same mistakes as your predecessors? So maybe I'll just point you to the question that's in the Q&A as well, that we've talked a little bit about, Germany as a G7 country, but it's also in the G20. So there is a comment question moving away from a G7 focused discussion towards a more G20 focused discussion and strategy when we think about funding the pandemic needs, as well as sharing vaccines knowledge and access, because there has been substantial changes. So I'm also abusing this a little bit as well. Today, the G20 presidency has just been taken over by Indonesia. I was very much involved in the C20 Global Health Working Group as one of the co-facilitators, and we really pushed around the TRIPS waivers issues in all the statements that we issued in the C20 policy pack. But then we have a lot of the developed countries in the G20 actually opposing the TRIPS waivers. I actually sat in as an observer in the Rome, in the Global Health Summit Rome Declaration while they were negotiating final text. And it was atrocious to the extent how they were dotting the I's and putting the apostrophes. It's while people's lives were being lost. We have learned from HIV, but we're still doing this. So remarks from you, Dianne, Cindy, and Matt around this. What are our leaders not doing on these platforms? And it's not just Germany's role. It is also the implementing countries' decision makers' roles to actually put a voice out there. Matt, maybe you first, or Dianne. Scissors, paper, stone. Ladies first.
Matt, I spoke first last time.
All good either way. No, this is great. I mean, so I think three core pieces from me. One, we are in this world that I think is decreasingly monopolar, right? That the kind of the world of just understanding the G7 as the G7 as the only body that matters, I think that is decreasingly so. So on the one hand, I'm very sympathetic to the idea of shifting to a G20 focus, shifting to a much broader lens, the G7 being an undemocratic kind of way of thinking about the world. That said, I think we have seen in the most recent period very clearly, as you're saying, Rachel, the power of the handful of the wealthiest and most powerful countries to set the agenda. And we should not ignore that reality. And so therefore, we need to be in a place that does not just say, sorry, we believe that there's a multipolar world and therefore the handful of countries that are blocking the TRIPS waiver, or the handful of countries that actually have the ability to inject, trillions of dollars into their own economies that have not matched that by injecting the billions of dollars into the world and supported the trillions of dollars that are needed for global economic recovery. There are a handful of countries that have that responsibility. And so it is great to be here talking about Germany as one of those. I'm sitting in Washington, DC, and another one of those. There are these handful of core countries that are exercising power. And therefore, they have a particular responsibility to match that power with it. But look, let's be real. We are also sitting here in the moment of Omicron, in which everyone has now responded by shutting down travel in the most inappropriate way. And I won't repeat what's already been said, but it illustrates the reality that the imagination existed out there in the handful of the wealthiest countries in the world, that there could be a distancing, that we could solve this by having vaccines and boosters, and that could be a solution to pandemics. We've learned this message in HIV. We've learned it in TB. We've learned it now again under COVID. There is no such thing as dealing with a pandemic by closing your borders, by imagining that you can only look inward. That is a failed strategy. So the question is, are we going to see reversals there? And I think that's going to have to come from the G7, or else very little is going to happen. I will 100% agree with you, Rachel. It is not just a matter of those handful of countries, though, right? And as we look at the kind of broader questions, right, we're going to have to see leaders in the entire world stepping up to say, how do we move? You've seen India, you've seen South Africa, you've seen others kind of stepping up and saying, this is what leadership looks like in a way that's been powerful. But you've also seen Thailand step up in this kind of brilliant way and say, this is some interesting things. So leadership is coming in various ways. The AU has led in ways that have been very impressive, right? And I think if you look around the world for global solidarity, you actually only see it right now in the AU, in which there is actually, work being done where countries are saying, we will step back so that you can step forward, we will share, we will govern together. And so interestingly enough, I think the richest countries in the world have a lot to learn from some of the least rich in the world, and that actually could be a lesson going forward. But let's be real, the money is still in a handful of places, and therefore the responsibility still lies in a handful of countries. Thanks.
Thanks, Matt. Dianne?
I totally agree with what Matt just said, and Rachel, you explained very well our experience over the last year of the G20. So I think we were all rather disappointed with the G20 set out with a very ambitious, egalitarian, rights-based agenda, and then ended up where it ended up. So I don't know if I have a huge amount of faith in that, but I know that Indonesia has a good vision. Let's see if we can make some change over the next year. So maybe what I'd like to say is how, to Matt's point about where the power is and so on, just again, drawing on our HIV roots, how did we speak truth to power? To, really, to speak from my South African roots, how do we really confront these things that we don't agree with, and where we see inequity and we see injustice? What do we do about it? And I do think we have some work to do as a global community, as an activist community, as an advocate community, as civil society, to join up and be more effective in a kind of comprehensive rights-based advocacy. Because I think what we see now, and how things have developed with the SDG agenda and so on, is everyone has their own little silo of priorities, whether it's climate or HIV or TB or sort of gender. And the Global Fund's new strategy is actually saying people are at the center of our strategy. So it doesn't matter, so much whether you're talking about an HIV or TB program. We're talking about who's the human being who is coming in to seek health services and what do they need. And so I think we need to be flipping this agenda on our activism as well, and kind of working together in unprecedented networks. We need to be talking to the climate people. We need to be, as global health people, we need to be talking to the gender people. And we need to put, a real people power behind a movement for equity and human rights. And part of that is also addressing the misinformation agenda, which has not helped us in our cause, right? To think that 20 years on, we're still having evidence-based arguments about global health interventions is super frustrating, right? So we as advocates also need to go to the G20, go to the G7, go to where the power is and say, here is the evidence base, here is the real messaging that we want as the people at the center of this movement, and kind of demand accountability. I don't see any other way. I mean, we managed to do unprecedented things by doing that before. And I think we have a lot of work to do to join up and speak with one voice about that now.
And Cindy, maybe very quickly, what are your thoughts about that?
Thank you so much, Rachel. I think for me, it's a question of having one global health strategy, having global health leadership, and also recognizing that leadership is at different levels, whether it's G7, G20, and many other available structures. And also we need to bring in the issue of, or the principle of shared leadership, shared responsibility. I think that needs to be the guiding principle. I think our African leaders have really experienced what marginalization feels and look like through COVID-19. They were on the margins when decisions about them or decisions that would affect them were made. So I think it also calls for the African bloc and of course other blocs to really look at, leadership at that level as well, and having a voice that could also influence what happens at the level of G20 and what happens at the level of G7. So for me, it's about ensuring that we have strong, focused leadership across the board. Thank you.
Thanks, Cindy, and thanks, Matt and Dianne. I think we've run out of time now. Let me just take a moment to just thank all of you. What I hear a lot from these discussions is we're all saying similar things, but in the places where it matters, the narrative or the rhetoric is not being backed up by deeds, right? And we need to find a way to bring this together. Excuse me. So it's really good to have the conversation, to hear from different levels, and really happy that both you, Dianne, and Matt could step in to speak so that we could have a conversation. So thank you to both of you. Cindy, as always, thank you for bringing a community perspective, a country perspective, which is so easily forgotten when we sit in a global, when we're having a global conversation. I will hand over to Rachel to say a few wrapping up things that lead us into the next session. But just from my point of view and from Frontline AIDS, thank you for having us, and thank you for starting off on a really energetic note on this important day. Over to you, Rachel.
Thanks, Christine. It's a pleasure working with you as well. And I've also had for espresso, it explains my excitedness. I just wanted to add that, this is, this group of people that we have in this room, we know what needs to be done, and we need to make sure that the others listen so that we get there, so that we don't continue navel gazing, as we call it. What is really important is that decision makers need to sit up, they need to act. Because I think we're really tired of listening to the same rhetoric, as Dianne had said, over and over again and seeing lives lost at the end of the day. So I will move on. Thank all of the speakers again. Thank you so much, Dianne. Thank you so much, Cindy and Matt, for being here and for being so inspirational as always. For all the attendees, please don't drop off. Please stay online. We will be back in 10 minutes for the next session, which is Communities in Action and Where Do We Go From Here? This is hosted by Gfan Asia Pacific and will last till 12:55 Central European Time. A very huge thank you to all the translators. Apologies if some of us do speak too fast sometimes, but thank you for the efforts and also making sure that all of us understand each other during these discussions. Do note that we do have a rapporteur. Daniel was introducing himself just now, and we will have a report from this conference from a community perspective, which will be published on the homepage together with the video of the conference. So thank you again to all the speakers. Thank you, Christine, and thank you, co-organizers, for having us here. See you guys in 10 minutes for the next session. Stay online. Thank you.